How are you? Well, I'm very glad you're here and ready to go because this is a show that will save lives. Now, over the next hour, 11 people in this country will die taking an over-the-counter drug mixed with a prescription drug. That's right, 11 people, an hour. We can turn that around today. When we walk into a drugstore looking for relief for a cold or a headache, we just don't think about the damage we could do. There's a growing alarm in this country now about the deadly consequences of mixing over-the-counter drugs with prescription drugs. Just because you can get them easily doesn't mean that you always should. Take a look. What do you do when you're taking a prescription medication and a cold comes on? Most of us head straight for an over-the-counter medicine to help relieve our symptoms. But by doing this, could you be risking a medical emergency, even death? Every year, 2 million Americans have what's called an adverse drug reaction, a fancy way of saying we mixed the wrong meds. And the consequences can be deadly. 100,000 of us die each year from adverse drug interactions, making this the second leading cause of accidental death in this country after car crashes. What's behind this shocking epidemic? Most of us just don't know how strong many over-the-counter drugs are. More than 700 of the medicines you buy over-the-counter without a second thought actually required a prescription less than 30 years ago. Yet nearly 90% of us believe that these non-prescription but highly potent medicines are perfectly safe. And they are, but only when used as directed. With nearly 4 billion prescription medications dispensed each year and over $40 billion in over-the-counter medicines sold, knowing which combinations are safe and which are not just may save your life. Get a pen and a paper because today I'm revealing the 4 deadly combinations of over-the-counter drugs and prescription drugs. Now, the 2 people joining me today are in the front lines, the pharmacist and the emergency room doctor. First off, Walgreens pharmacist Stacia Woodcock, and secondly, emergency room physician Dr. Lee Vineker. She's with the University of Maryland School of Medicine. So, Stacia, let me start with you if you don't mind. We just heard that we spent about $40 billion in over-the-counter medications. And are they really safe?
They are safe, but as you said, they need to be used as directed, and unfortunately, a lot of people don't have the time to read the tiny fine print on the boxes to know what's safe to take with them. And
when they don't do that, then sometimes they wind up in Lee's emergency room. So talk to me a little bit about what you're seeing there.
Well, about 700,000 adverse drug reactions a year end up in the emergency room.
So I'm usually in the emergency room with Lee and seeing what actually happened, but I've been taught over the years how important pharmacists are. So if you could, just give everyone the #1 item on your list, your wish list.
The #1 item on my wish list is for everyone to ask questions. Come to your pharmacist. We are the medication experts, and our answers are free.
Okay, so we're going to cover the 4 big ones that are on my mind right now. The first over-the-counter medicine mistake that women can make is mixing pain pills with blood thinners. So if I could ask you guys all, put your hands up. How many of you are on a blood thinner? Good. And how many of you have friends or relatives that are on blood thinners? Yeah, it's a good part of the audience. In any case, as a heart doc, that runs into a problem with the medications we offer, because a lot of times we'll give you a blood thinner and then you go off and take a medication that's actually designed as a painkiller, for example, ibuprofen. So if you could, maybe Lee, you would tackle that, because I'm sure you see this in the ER. What happens when you mix those 2 together?
They're a very dangerous combination, because what happens is the ibuprofen gets rid of some protective chemicals in the stomach, like prostaglandins, and the stomach lining gets worn away. And I've seen, because now you have a blood thinner, and plus it affects your platelets, which are a clotting particle in the blood, and then they come in with a massive bleed and hemorrhage from their stomach. And sometimes they bleed to the point of shock. I've seen people come in with heart attacks from that.
I have as well. Let me bring us alive, if I could, with a very short demonstration. So let's say you've got a stomach that looks like this, and you have a little hole maybe made in the stomach, an irritation from an ulcer that you have. Now, if you have the normal blood clotting in your body, let's say this is your blood, you pour it into your stomach, nothing happens. That hole's still there. I don't know if you can see that well, but that hole's there, but no blood's leaking out of it. Now, Stacia, come over here if you don't mind. Hold that up. A little demonstration here. Thank you. Usually, just hold it that hand. Good. All right. And then I'm going to now demonstrate what happens if I've got that same problem. Right? I took the same painkiller that irritated my stomach, and now I'm on a blood thinner. So no longer do I have a stickiness in my blood. I've got the same tube with the blood thinner in it, and I pour it in here. And all of a sudden, you're in Dr. Winokur's emergency room with no blood in your body left because you've drained it all out, bleeding into the ulcer in your stomach. You can all see that pretty readily? All right. So with that as a general thought, I want to now, if I could, ask the sort of the big question you're all wondering is, what are you going to do about it? So, Stacia, if you're on a blood thinning medication and you have a pain at home, what should you take?
The safest thing to take when you're on a blood thinner is acetaminophen. But again, always ask.
Make sense, everybody? All right. Now, the second over-the-counter medicine mistake that I see so frequently, and women make it all the time, is that they combine pain pills with diet pills. Now, to bring this alive, we actually asked someone to join us today, a young mother who recently wrote to us. And she'd taken over-the-counter migraine medication while also taking prescription diet pills. She's lucky to be alive.
Dear Dr. Oz, my name is Melissa. I'm 25 years old and a mother of 2. I gained a lot of weight with my pregnancies and desperately wanted to lose it. Earlier this year, a doctor gave me a prescription for diet pills, and I started taking one a day right after breakfast. Within 2 weeks, I was getting really bad headaches, but only on the left side of my head. I thought it was a migraine, so I took over-the-counter pills, but it just got worse. This went on for more than a month. Eventually, the pain got so bad, I passed out twice, and I couldn't move my arm. My husband rushed me to the emergency room. I was in the hospital for 5 days. Turns out I had a minor stroke. I still can't believe someone as young as me could have a stroke. I've stopped taking the diet pills, but I still can't smile. I want to be there for my kids, but I live every day scared it can happen again.
Melissa, thanks for joining us.
Thank you.
How are you feeling?
Much better.
I'm curious now, what did you think was going on inside your head?
First thing I thought was the pills, because I was perfectly fine till I started taking them. I started feeling weak, then I started getting the headaches. Also, I was working out at the same time, so I thought it was maybe that I was working too much. But first thing that came was the pills.
Let me show you something. Here's a picture of what you looked like at the time. In fact, that you would look like that. I mean, you had a stroke.
Yeah, and the worst part is I can have one within 12 months again. So it's pretty scary.
So, Stacia, walk me through a little bit, at least describe to me a little bit about this diet pill. It's a prescription drug.
It's common, yeah, it's a prescription drug. You do need a prescription from the doctor to get it. But again, as you mentioned, so many people take it, they don't feel well, and their thought isn't, maybe I should ask someone. It's, well, I'll just take something else and something else. And so you end up taking 5 pills for a side effect caused by the first one, when in actuality, you needed to stop taking that first pill. And so it just adds on and adds on and adds on. And then unfortunately, the migraine medication that Melissa took, in addition to that diet pill, had caffeine in it, which compounds the blood pressure issue, raises it higher and higher and higher. So it was a very dangerous combination that she took. So again, ask questions. I can't stress that enough.
So I hope this helps a lot of folks out there. I know that it will. And we're going to follow with you as well. But I want you to continue to be the eyes and ears of America. We're going to talk about the other 2 major concerns I have. The third one is taking calcium with hypothyroid medications. 2 very common things, right? Calcium we keep telling folks to take to support their bone growth and their muscle health. But we also tell you that you got to check your thyroid levels to make sure that you're not depleted in them. It's the most common hormonal problem in America. So, Stacia, walk me through, if you don't mind, a little bit about how you think about people who are taking thyroid medications for that ailment and calcium.
A lot of women take thyroid medicine, and unfortunately they may not necessarily know thyroid is a hormone. That means it's very sensitive when it's absorbed in the body if you take other things with it. So what happens is the 2 kind of combine together. It makes the body difficult to absorb that thyroid hormone because it's bound by that, those big calcium pills. And so then your hormone levels drop, you can't sleep, you get hot flashes. So it's really, really important to know that you have to separate those medications. And it's best to take the thyroid on an empty stomach first thing in the morning, about 4 hours separate from any other multivitamins or calcium supplements.
And finally, fourth, and maybe Lee can talk us through a little bit about the medications that patients take for 2 of the most chronic illnesses we have in this country, diabetes and high blood pressure, and how they can also be affected by something as simple as a decongestant for a cough or a cold.
Yes, well, decongestants can actually affect your blood sugar. So if you're on insulin and you have a cold and you take some kind of nasal spray as a decongestant, or if you take a decongestant pill, it can actually affect your sugar levels. Not to mention, people are drinking cough syrup and things which have sugar in them too, and sometimes people don't even count that as part of their intake for sugar. And the other problem with decongestants is they raise your blood pressure. So if you're very sensitive, it's going to raise your blood pressure and it's going to affect it. So it's going to sort of negate the medicines that you're taking for blood pressure.
So I think we've covered pretty artfully some of the big categories of interactions. There's a lot more. This is not to scare everybody. What it really means is you at least have to keep track in your own mind of the problems you're facing. And it's okay to put your hand up and say, hey, you know what? Here's what I'm doing. Something's not right here. And because you know what, frankly, the fact that you went back to the ER again, I think saved your life.
Yeah, I think so too.
Stacey Wilcox of Walgreens, an emergency room physician. Dr. Lee Vinegar, thank you both very much. We'll be right back.
Coming up.
I'm so thankful for this show. It really has